All right, I'm going to do a quick whirlwind through a few things and then get into stuff like managing vaccinations, nutrition, whether you can ride them, all that sort of thing. So we've got a mare that's pregnant. First time I like to do a preg check is at about 14 to 16 days. Why do I want to do it then? And particularly I like 14 to 15 days. I want to do it then for two reasons. One, if she has twins, that's the best time to take care of them. There are some options after that, but it's way easier and way more effective, as in she's more likely to carry the pregnancy to term if I deal with them at 14 to 15 days. Just remember that uterus is only built for one, and if you leave them go, chances are if they get to about a month and a half, what you're going to wind up with is an abortion at about 8 or 9 months along. So I like to deal with it then. The other reason to look at her then is if she's not pregnant, we can start to set her up for the next breeding cycle. So get you in front of the ball game. But this is the best time to do them. And you basically have the client, you pick which one the champion is going to be, leave that one alone, move the other one far away from it and crush it. And usually the mare's going to get some Regimate and some Banamine at the same time. That has been shown to improve the chances of keeping one pretty well together. After that, and if I was looking for twins, like I knew she double ovulated, but I only found one, which I kind of hate. I'd rather find twins because then I know I'm not missing anybody. But if I only find one and I'm suspicious, I might want to recheck her a couple of days later just to make sure that I've ruled the twins out. If that is not the case, and I'm only looking for one, or I know I've dealt with the twin, then my usual next check is at about day 30 to 35. Now, we used to do a lot of them at 24 to 25 days, which is the first time you can see a heartbeat. But people kind of got blasé. They've all seen heartbeats on ultrasound now, and no one really cares anymore. The only time people do a lot of 24, 25-day checks these days is a lot of the embryo transfer farms will actually sell you the pregnant recipient at that point. So they do a preg check then, and that's when you owe them more money. But the reason for doing the day 30-35 one is that if she is pregnant at day 30 to 35, she's going to make these structures called endometrial cups in the uterus. So this is the embryo over here, and it's got this set of cells around it called the chorionic girdle. And at about day 36 to 38, they migrate off the embryo and they invade the uterus. And they look like these bands or little individual mushroom type things, I guess. And once they're in the uterus, they will not die. Even if the rest of the pregnancy dies and you lose the rest of the pregnancy, they will hang around until about 120 days. And while they're there, you cannot rebreed that mare. She will not get pregnant. So I do that 35-day check. And then if she's pregnant, then we're kind of done, right, for the rest of the year, as far as attempting to breed her goes. After that, you may have another check that the breeding contract says you have to get her preg checked at a certain number of days, and that's when some of the money is due. And then sometimes we also check them later in the fall, just to make sure they're still maintaining the pregnancy at that point, so that we're not feeding them for two when they're really lying to us and they don't have another one inside there. So that's just for management purposes. Other thing, once we've got her confirmed pregnant, usually at about 14 days or so, if she's got bad perineal conformation and we haven't already put a caslic in her, we'll usually put her permanent caslic in that's going to last through the gestation. And we just have to remember it's there, so we take it out before she foals. Once you've got her pregnant at day 14, the chance she will lose the pregnancy really depends on her age. So we talk about the embryonic period, which goes up to about 40 to 50 days, and then the rest of gestation. And the chance of a young mare, if she's pregnant at day 14, losing a pregnancy between then and day 40 is about 6% or so. You'll see down the bottom, it varies maybe to 10, 14%, but mostly they're around 6 or so. And then after that, she has less than a 10% chance of losing that pregnancy. So pretty good odds if you've got a young mare that she'll keep it. If you have an old mare, and the older they get, the worse they get, she has a much greater chance of losing that pregnancy, both by day 40 and then after day 40, before she actually gets to foaling. And it really is an age-dependent phenomena. So if this is the chance of her losing a pregnancy between day 14 and day 50. And you can see when you get to the oldest mares that are up around 20, even if she was pregnant at day 14, a third of those embryos will die by day 50. Whereas if she's a young mare, you're still down around the 10% or so range. So it's a much greater chance in an old mare. Part of that is just her eggs weren't as good. So she may have some genetic issues with her eggs, much the same as people get when we get older. And the other thing is her uterus, her uterine environment is no longer as good. So she has a number of reasons to lose it. Once she's well and truly pregnant, we've done our preg checks, then realistically, she's on maintenance and we're just watching her for problems. And often the first sign of a problem, if you get a sign, if she's going to abort, is that she will bag up prematurely. So you've got a mare that's 8 months along and she's suddenly starting to develop an udder. That is a bad sign. Occasionally, if they've got a uterine infection, which we would now call a placentitis because it's infecting the placenta, they will also get a vaginal discharge. But most mares that do have a placentitis do not show a vaginal discharge at all. So this premature bagging up, looking like she wants to give birth, is kind of our sign that something's wrong. And when we get that, really what we start to think of is, did we get our breeding dates right? Or did we write something down wrong and she's really pregnant further than we think she is? And in horses, mostly the breeding dates are right. The other thing is, did we miss some twins? Because essentially what's happening at this point, if she thinks she's ready to go, is the uterus is running out of room. So the twins are getting stressed out and moving. Is she a real old mare with a real fibrotic uterus? And the foal just can't get enough nutrient out of it. So it's getting stressed for that reason. But the number one reason we would see for late pregnancy in doing this is a placentitis and infection. So we'd want to assess that, put her on treatment for that, which is going to be antibiotics and anti-inflammatories and Regimate kind of deal. So once we've got it to the point where we're a few weeks from foaling, if she's going to foal somewhere that is not your home farm where she's been living the whole time, ideal world, you transport her to that place maybe 2 months or a bit less before she gives birth. A lot of times we don't like to transport them in the last 30 days if we can avoid it. But the reason you want to get her into that environment is A, so she settles down, but B, so she gets exposed to all of the different bugs that are in that environment that you don't have at home. So the different microorganisms. What she's going to do is she's going to get exposed to them. Mostly she's going to pick them up in feed or something like that. They will go through her gastrointestinal tract and her immune system will see them. And it will respond and it will mount antibodies against them if they're novel organisms. And those antibodies will actually wind up in the colostrum. So the foal is prepared to face the microbes that it may face when it's born, kind of deal. Another thing we like to do is vaccinate her, give her her final booster at about this 4 to 6 week mark. Again, we're just trying to boost the mare's immunity so that she puts all of those antibodies into colostrum for the foal. And then if she's had a caslick, once we get to that last week, and obviously it's a bit hard sometimes to tell when the last week is because mares are so variable, but once she looks like she's getting ready, we want to take that caslick out again. We're going to open her up. So usually we'll put a little local block in there, slide a finger up, and just open it with a pair of scissors. And the reason we want to do that is we will open it in a nice straight line that is nice and easy to suture back together again, because once they've been caslicked, they pretty much need to be caslicked for every pregnancy thereafter. But if she opens it, and she will, it will not stop her from foaling. When she decides to foal, she will just foal straight through her caslick. Mares do not listen to stop when they're foaling, and she will tear it, and it will go all sorts of directions. So we want to avoid that if we can. So that's kind of some of the real overview basics. So now we're going to talk more specifically about vaccines, and then we'll move on to other things. So we've got basically a few goals. One is we want to protect the mare from disease. We also want to stop any potential contagious abortions if we can. And then we also want to prime her so she has lots of antibodies, again, to put into that colostrum so the foal gets lots of passive immunity so it is less prone to getting disease after it's born. The other things we want to look for is the vaccine safe, both for the mare and for the fetus that's inside her? And then you start to have to think about how many can I give at one time and have her still respond to them. And some people would say the maximum you can give at a time is 4 or 5. And we'll see that gets to be an interesting issue because there's a whole lot we'd like to give 4 to 6 weeks before she foals, potentially. So vaccination for broodmares basically follows the same tenets for most adult horses. We have these core vaccines, which we're going to vaccinate every horse for. So they're going to be tetanus, encephalitis virus, West Nile virus, rabies, and herpes virus. They're the ones that they all should get. And then the rest of them are kind of, it depends. It's a risk assessment. It may depend on where she's going to foal out. So if she's going to Kentucky, for example, they've got an issue with botulism on some farms. They've got an issue with rotavirus on some farms. So we may decide to give her those particular vaccines. Whereas if she was going to foal up here, I'd probably say, I'm not going to do that. She doesn't need those ones. So it's risk-based. So for the vaccines that are core, you'll see down here that there's a whole lot of, I want to give this vaccine 4 to 6 weeks before she gives birth. That's the same, giving the amount of time for her to respond to it and get those antibodies into the colostrum for the foal. That's what we want to do. So when we do these vaccines, we want an intramuscular vaccine because that's the one that's going to cause immunoglobulin G, which is the one that gets into the colostrum. So we want an injectable one, not an intranasal one, if there's anything intranasal. So we want all these things. There's more than 4 vaccines here, Scott. What are you going to do? So most people out of these vaccines are going to take the rabies out of the picture and they're going to give that at a different time. And mostly they will wait till after she's foaled and give it before she's bred, essentially, is when they will give that rabies vaccine. Rabies vaccine is a great vaccine. It gives great immune response. And so you can give it well ahead of when she's foaling. The other one that may move eventually is tetanus. Tetanus is also a pretty good vaccine, but no one's done the work to say how far you can spread your tetanus vaccines out. And horses are particularly prone to tetanus. So these other ones, the encephalitis, the West Nile virus, we're going to give 4 to 6 weeks postpartum, 4 to 6 weeks prepartum. And then the herpes virus, which is the rhino shot, which is the one that is, if any disease is going to cause an abortion storm, it is probably rhino. That is the one we give at 5, 7, and 9 months. And some people will even give it at 3 months as well. And even then again, they might give another one at 4 to 6 weeks before she gives birth. But mostly the standard is 5, 7, and 9. With the encephalitis virus, and especially West Nile, if you're in an endemic area where these things are really common and the vector lives a long time, so they're mosquito borne, and you have a really long mosquito season, it's possible that in some places they're going to become susceptible in spring and then they're going to have another susceptible period in the fall. And you might actually want to hit those mares twice a year with some of those vaccines, depending on your situation. Mostly around here, we're pretty good with one. How safe are these core vaccines? They've been used for a long time and they are safe. So the tetanus is an inactivated toxoid. It's not even the bug itself. It's perfectly safe. The Eastern and Western encephalitis viruses, they're viruses, they're whole viruses, but they've been killed by formalin. So they're a safe virus, safe vaccine, unless something happened in the plant. They didn't kill them, and so far that's not happened. West Nile virus has no products that are actually labeled for use in pregnant mares, but all of the ones that they've looked at so far are safe. They've either used them in trials or people have given them to a whole bunch of pregnant mares in practice, and nothing bad has happened. And things like the Recombitech, it's based on a canary pox, can't infect a mammal anyway. So they're safe in West Nile. Rabies, again, no products are formally labeled for use in pregnant mares, but all the vaccines out there for horses are inactivated vaccines. So if you did have to give one to a pregnant mare, safe to give. And then herpes virus is probably the most interesting one. So there's 2 that are labeled for doing the 5, 7, and 9, or 3, 5, 7, and 9 shots. One is Pneumabort K, which is a killed vaccine. The other one is Prodigy, which is also a killed vaccine, which has really high amounts of antigen in it. There's other killed vaccines that don't have high amounts of antigen and are not as good. So we like to use these two. The other one people sometimes use is the Rhinomune because it's a modified live virus. And the usual deal is you don't want to give a modified live virus to a pregnant animal, but it has been used many, many times and has been shown to be safe. One thing we usually don't do with any medication or a vaccine, or even a deworming if we can avoid it, is we try and avoid giving medications in about the first 2 months of pregnancy, in that embryonic period of fetal development, of embryo development. That's probably the most dangerous part where something bad could happen. So you don't want to stress them out there. The risk-based vaccines, up here, a lot of people will use influenza, and that's fine to do. There is one that's labeled for use in pregnant mares, that's the Calvenza. You do want to use the intramuscular vaccine because what we're aiming to do is get circulating immunoglobulin in the bloodstream that will go into the colostrum. What we're really aiming to do is protect the foal as well as the mare, right? You could do in mares a semi-annual shot, so you could do every 6 months and just make sure one of them is in that 4 to 6 weeks before she gives birth. But it is often used because if you've ever had horses with influenza, it really knocks them when they get it. So we would like to avoid our broodmares getting it. And especially if she's on a farm where there are horses coming on and off, like she's at a show barn or something, it's a good one to give. Botulism has a course for the first time of about 3 shots. It's used basically to protect the foal from getting botulism, and they call it shaker foal syndrome. Botulism, probably know about it from Botox, but it basically relaxes muscle. So we don't really use it around here, but if your horse is shipping out and going to Kentucky to foal out, or one of the mid-Atlantic states, it's something to think about, giving it a botulism shot. And you would want to talk to the farm down there and see what their situation is. And they might recommend it. Strangles can be tricky. You're mostly trying to protect weanlings and yearlings because they're the ones that get the worst disease. If an animal's been infected with it, you usually have pretty good immunity for about a year afterwards. Really, when you're doing brood mares, you're trying to protect their foals. So you're using, again, the IM shot, not the intranasal. Intranasal vaccines cause local immunity in the nose, and they'll stop the mare from getting infected, but they don't cause good antibody formation in the bloodstream that will actually get into the colostrum. So we don't use them. If you are thinking of using a Strangles vaccine, if you do have a problem on the farm or where you're bored, you want to talk to your vet because if the mare has had Strangles before and has really high titers, then she is actually at risk of getting an immune-mediated disease as a result of the vaccination. So it's a risk benefit, and often we'll take a blood sample on those mares and measure their antibody titer to Strangles before we start. Rotavirus, usually not around here, but in Kentucky, yes. So it's designed to protect the foals from getting diarrhea. Annually, you've got to do 3 shots annually to the mare. So you can't just do that the first year and then 1 shot every year after that. But it's a safe vaccine for use in mares. Gives the foal antibodies. These other ones are basically not really recommended. Potomac horse fever one is licensed for use in pregnant mares. If you look at the data, its ability to protect animals from Potomac horse fever is a little questionable. If you lived in a real endemic area, couldn't keep your horse away from the stream, or the mayflies kept attacking your barn, you might want to use it. You could use it in a pregnant mare. Anthrax, you would not give to a pregnant mare. The vaccine, you wouldn't want to give anthrax to it. And viral arteritis is a live virus vaccine over here. And so we normally don't give it. If you have to breed a mare that you know is going to get exposed to EVA, usually through the stallion or the semen, you want to vaccinate her before she's bred. They did use some live virus shots in late pregnant mares in the big outbreak they had down in New Mexico, and it went okay, but usually you wouldn't use it. So that's vaccinations. Next thing we're going to talk about briefly is controlling worms. And this is damage from the most common worm now, which is small strongyles. So these are all encysted small strongyles in the colon of a horse, all these little brown dots. are just encysted little worms sitting under the surface of the gut. Doing parasite control has changed a lot over the last 10 years, right? So we used to deworm everything about every 2 to 3 months and call it good. Trouble is we built up a heap of resistance to that. And now a lot of the worms are resistant to our antibiotics. You don't give them antibiotics, Scott, you give them dewormers, anthelmintics. So the strategy now for everything except foals, weanlings, and maybe yearlings is to do targeted deworming. So basically the idea is you're only treating the animals minimum number of times, and you're not really trying to get rid of all the worms. And you're determining who are the worst offenders when it comes to putting worm eggs out into the environment. So the idea is you find who the high shedders are. So you do fecal egg counts. And ideally you do them twice a year, but you certainly do them in the spring, maybe year one, you might do them spring and fall. And the horses that are high shedders or high contaminators, then you treat those more intensively. And you can also monitor resistance to different dewormers on the farm. So you would go and do a fecal egg count to see how many parasite eggs were coming out of her. You would deworm her, and then about 2 weeks later, you would come back and do another fecal egg count. And you would look for how much reduction you'd had in the number of eggs coming out. And for things like moxidectin, stuff like that, you want to see like a 98% reduction. If it's less than that, you think, we might be getting resistance. For some of the other dewormers, you might be looking for a 90% reduction in egg count. Foals and weanlings and yearlings, we still deworm them really regularly, 2 to 3 months. They get a particular problem with Ascarids, which are the big white worms that look kind of like spaghetti, and they will get impactions in their large colon, and it will kill them. They get colic and they can die. It's a nasty, nasty disease. So basically the broodmare is like any other adult horse on the farm. So what's going to happen in the Midwest probably is in April, as they're about to get out onto pasture, you're going to form fecal egg counts. That's what FEC stands for on this slide. But you're going to treat anyway, right? And so usually we're going to treat the whole herd with an ivermectin or moxidectin and praziquantel, which is the one that gives the tapeworms. We're going to do it with a combo of those. And then October, we're going to do the same thing. So realistically, these horses are getting twice a year treatment, and that is it. But if we identify high shedders on the fecal egg count, horses that shed a lot of worms, and so a high shedder is anyone who's shedding over 500 eggs per gram of feces. So you're actually looking at it under a microscope. For their high shedders, we're going to give them extra treatments in June and August. So they still get the one in April and October. They get extra ones June and August. Those ones are often with a benzimidazole, which is like Panacur or something like that. We used to call them white drenches. They're the ones that aren't clear. They're opaque kind of drenches. Some of them are pink, but that's just colorant. You'll use that. If it's a moderate shedder, so not quite as bad, somewhere between 200 and 500 eggs, then they'll just get one extra treatment, and that'll be in June. And our low shedders, they're going to get nothing. They're just going to get the April and the October ones. So that's how you sort of work it. There has been a long tradition in the horse world probably 20, 30 years, of treating mares about the time they foal. So the day before they foal, the day they foal, with something like ivermectin, to kill a worm called Strongyloides. Now, Strongyloides kind of lives under the skin of the mare, and at the time of birth, it migrates and gets into the udder, and then it gets secreted in the milk, and the foal gets it in the milk, and you can start to see eggs in the foal's poop at about 2 weeks of age, right? So this infects the foal by going through the milk. So we used to give this shot to try and get rid of that, this dose of dewormer close to foaling. Occasionally, this worm does cause foal diarrhea. It's not the cause of foal heat scours, which is what everyone used to think. Basically, these days, a lot of times we're going away from doing that day of or day before dewormer. it sort of depends a little bit on what the risk on the farm is and when the mare was last dewormed, right? So if this foal is being born in April and she just got her big hit a couple of weeks ago with ivermectin or moxidectin, then you don't need to do this day off, right? She's covered because she just got that really good hit. And even if that was a couple of months ago, she's probably fine for it. If the mare wasn't dewormed recently, you may want to give her one if she was in a place she could pick up worms. So if she was stalled all winter, she's not going to get many worms over the winter time. Like anything else, we try and avoid deworming in that first 60 days of pregnancy. And pretty much all of the dewormers on the market at the moment are safe to use in pregnant mares. The ones that were dicey are mostly off the market now. But if you got any questions and you happen to go buy them at Fleet Farm or something, just look at the label and see what it says. And a lot of them are actually labeled for use in pregnancy these days. Okay. So the other thing we want to do is avoid bringing disease onto the farm. So we've got to talk about biosecurity because our pregnant mares are kind of a really valuable asset, right? And the way a lot of farms are set up is they can potentially get exposed to disease. So we want to avoid that. We're really worried about diseases that will cause them to abort, particularly. But any disease that causes them to get sick and lose condition is not great for their pregnancy. So a lot of farm setups here I've got written are a biosecurity nightmare for broodmares, right? If you're on a stud farm and you have stallions on the stud farm and you allow outside mares to come in to be bred to those stallions, those mares will come in, they may stay on the farm until they're pregnant and get discharged, but they've come from somewhere else with their own particular set of bugs. Or sometimes you just get trailer inbreedings, right? So the mares come in, they hop off the trailer, the stallion breeds them and they go away again. That's great. They probably didn't have contact with your pregnant mare, but they did have contact with the stallion. And the stallion, if it's a natural service place anyway, the stallion then has contact with other mares on the farm that are being bred who might have contact with the pregnant mares. So you've got to worry about that risk. You do have to worry about shipping in bugs with semen. So viral arteritis is one we really worry about with this one. Stallions that carry equine viral arteritis shed it in their semen and it survives cooling, it survives freezing beautifully. And if you inseminate a mare with it, she will get infected and she can then infect other mares that are in contact with her. So you've got to sort of watch that. You do need to know if the stallion that you are getting semen from is a shedder. He may have positive antibodies but no longer be shedding, and that's fine. But you want to know, is he shedding it in his semen? The other deal is you've got show horses and race horses that may be going on and off the farm. So they go to a show, they're exposed to a bunch of other horses, they pick up a bug, they bring it back. And then on the farm, you've got these weanlings and yearlings, and they're like kids in daycare, right? They're virus factories. So they're going to really amp up the infection. The other thing to remember is, especially with the virus we're particularly concerned with, which is herpes virus, the one that will cause real abortions, a lot of horses are already infected and they've been infected, and like a lot of herpes viruses, you never really clear the infection. The virus just sits in a nerve somewhere and it waits. And then when the horse gets stressed out, that virus will reactivate and come back out again. And a lot of times that's what you get in an abortion storm on a farm. There's been no movement, but you stressed out those mares and one of them recrudesced. They don't often show signs of snotty noses, which is what you see in yearlings and weanlings with it. But the first thing you may see is an abortion. And so that's important to avoid that stress as well. So what do you do for biosecurity? Well, it's important to make sure your mares are all vaccinated. It's important to segregate mares as best you can. And this is obviously easier on a big farm where you have lots of paddocks. But ideally, you want to keep mares that are staying on the farm, your mares, or mares that permanently board there, away from transient mares that come in and out. You want to keep your pregnant mares, which are really your most valuable asset. You want to keep them away from all other horses. And away from means there is no chance of nose-to-nose contact, which really means you need 2 fence lines between them. So they are well apart. And there's not a lot of transmission in the air for herpes virus. It is possible if they shared a long water trough and there were 2 fences apart, but it was like 6 feet, that one that was infected could snot into it and the snot could float across the water. So try and keep them as separate as possible. Your pregnant mares ideally should be divided into small groups based on how far into pregnancy they are. And the idea behind that is not really that one stage of pregnancy is a lot more vulnerable, although later stages are a bit more vulnerable. But it's just to, if you get an outbreak of abortion in one group of mares, you don't want to go on through all the mares, right? So you want to keep them as separated as possible. And once you've got them divided, don't start bringing additions in or mixing the groups, because that does 2 things. It breaks your quarantine, brings in a new one that's potentially infected, and just remixing the mares stresses the crap out of some of them. And so they might start viral shedding. So you want to avoid all those things. You also want to think about biosecurity for your parasite control program, because you don't know what that horse has been on unless you've got a cast iron history. So a lot of times when a horse comes onto your farm, you're going to isolate it while you do a fecal egg count, see what it's putting out. You'll deworm it with a heavy hitting dewormer like amoxidectin, and you'll quarantine it for 4 days. And you want to do that because it's got to poop out the worms, right, and the eggs over that time. So you don't want any of the residual eggs contaminating your pasture. So it's best to do that in a stall or a dry lot and then dispose of the manure. So you keep it under quarantine really well. All right, so that's vaccination, parasite control. Next thing we want to talk about is moving pregnant mares around. Again, you try and avoid sending them real long distances in the first 60 days, but we'll see it's not necessarily too detrimental. So there's been a little bit of research done on this. So this was a study done out at Colorado State, and they took mares that were pregnant, and they were pregnant either 16 to 22 days or 32 to 38 days. And they took them for a 9-hour trailer ride. It was basically a big loop. So they went out for 4.5 hours, came back, they took a blood sample in the middle and sent them out again. It was not real hot when they did this. It was like in the 70s. They were diagonal load trailer. They did not give them any food or water for the 9-hour duration of this trip. And they kept non-transported controls at home that were matched for pregnancy stage. And then they drew samples and they checked them for cortisol levels to see how stressed they were. They looked at progesterone levels and they looked at them for embryonic losses. And basically all of the mares that were transported got stressed. They had cortisol levels. They didn't love going in a trailer. But if you look at their progesterone levels, and progesterone levels are in this graph, and these are the ones that were transported as the dark triangles, they actually got a boost of progesterone when they were being transported. So they were being transported for these first 3 data points on the left side. The rest of it is after they were transported. And the reason they got that boost in progesterone is it's probably a stress response. That's progesterone actually coming from the adrenal gland, not coming from the corpus luteum. But then it had no real effect on their progesterone levels after that for the next couple of weeks. And there were no increased losses. So basically, didn't matter whether you were transported or lost. If you were 16 to 22 days pregnant, 3 of the mares out of 15 in both of those groups lost a pregnancy. So there was no increased loss in the transported group. And there was no increased loss, at least not statistically, in the group at 32 to 38 days. And it was a lower level, which you would expect. Most of your embryonic losses happen early and they gradually get less and less as you go through. So not a big deal in that one. The only other one that's really looked at pregnant mares was this study out of Poland. And they looked at stress responses in the same mares over different stages of reproduction. And the first, they took them in a trailer ride. They took them for a trailer ride. They didn't control temperature because it was different times of the year because they were getting them in different stages of estrus and different stages of pregnancy. So that's a bit of an uncontrolled variable. But the first 3 things were before they got on the trailer and right after they got on the trailer. And then the last couple were when they were actually being transported and right after. And the biggest stress response was actually mares that were in diestrus. So they hadn't been bred yet, but they weren't in heat. And mares that were in seasonal anestrus. The stress responses that lasted longest were the mares that were in early pregnancy and the ones that were in foal heat. So not a whole lot to say. They didn't really look at pregnancy losses in this study, and hard to tell. So the usual recommendations for trailering a mare, and obviously mares get trailered around the country all the time when they're pregnant, especially in the thoroughbred world. We get them sent up here from Kentucky so they can fall out, so they can race in the Minnesota bred stuff. The usual rules of thumb are you want to trailer them about 30 days before they fall. Especially if you're going, and I'm talking long distance trailering now, right? If you're going to send them 9 hours kind of deal, anything over 6 probably. You want to have your trailer, or whoever's trailer is being used, if you're getting a transport company to do it, make sure the trailer's cleaned and disinfected before the horse gets on it. Ideally, it's got good shock absorption for transport. So they've done some studies, and if it's a regular trailer, then leaf springs are actually better than torsion bar suspension under trailers for evening out the bumps. Air shocks are probably the best, but they haven't done much of a study on those. But some of those big horse vans that have got like the loose boxes in them, they are beautiful to roll in. You want really good ventilation. You do not want dust building up. You don't want mold spores building up. You don't want bacteria building up, and you don't want heat building up in the trailer. They're all bad for respiratory disease, and that's one thing we're really scared of when we ship horses for long distances. The other deal is you want to be able to have the horse get its head up and down. If its head has to be tied up all the time and it can't lift its head higher or can't put it down lower, then that is probably bad and probably predisposes it to getting a respiratory tract infection. And they used to call that shipping fever. And it can be really, really bad. So avoid all that. If they're going on a long trip, you want some kind of absorbent bedding, but it can't have mold in it. So straw is bad because it's got more fungus and stuff in it. Non-dusty shavings, if you can find them, is probably the best thing. And obviously, once you get to the other end, you clean it out and disinfect. You want to stop every 5 to 8 hours, some people would say 6 to 8 hours, to water the horse. Dehydration and muscle fatigue are two big things that are a problem with long distance shipping, along with respiratory disease. So they're going to start to get dehydrated depending on how hot the weather is, but by about 6 hours, they'll get dehydrated if it's hot. So one thing you want to do is avoid hot weather if you possibly can. If you're doing this, ideally you would take water she's familiar with if you're transporting her yourself, especially if you're off a farm, because you may get to the other end and you find a place to lay up, but it's got city water and it's chlorinated and she won't drink it. So you want her to drink. And ideally you would unload her somewhere. So you pull into a farm or a stable or something. Don't have to expose her to other horses, but just to let her out, stretch her legs, have a drink and get something to eat. Take your own hay so she'll eat it. Make sure it's dust free. Again, the mold issue is a problem. And you can damp it down if you have to avoid that. And then do things like plan your route. So it's usually smoother and there's less curves to go on a freeway once you're on there, right? Make sure you monitor for traffic backups and things like that. You don't want to be stop-start. You don't want tight turns to keep them as comfortable as possible. Other things, and if she's going into state, she's going to have a vet certificate, a health certificate. So you want to make sure she's healthy before you go. Never transport a horse that's got a snotty nose. You're setting her up to get really sick. Make sure she is up to date on whatever vaccine she's needed to this point. Don't tie her head up, or at least tie it very loosely so she can get it up and down. Other things may or may not be done. So some people like to, because they know they're going to get dehydrated, they like to tube them with a gallon or so of mineral oil about 3, 6, 12 hours before she goes, just one of those times, just to avoid getting an impaction. Now, if you know you're going to keep it hydrated, it's not real hot, you can probably avoid that. A lot of people don't do it at all. We used to give antibiotics before long shipments, and it was just 1 dose before they went, which is really bad antibiotic use. And the recommendation is now you don't do that. So there's no antibiotic shot before shipping. Some people, if the mare is sort of old and she's got some arthritis, trailer ride's going to be uncomfortable, they like to give her a dose of bute. It's okay. Just remember you've got to water her because you don't want to get getting dehydrated while she's got beauty in the system. Some people like to cover them with Regimate while they're on the trip and then take them off afterwards. Never done that. If the mare was already on Regimate, sure, but if she's not, haven't bothered with that. And then once she gets to the other end, basically she'll probably go into quarantine and they should temp her twice a day for about 3 to 5 days, just to make sure she didn't pick something up on the way down or get a lung infection. Because those lung infections, those shipping fever things, if you get them early, you can treat them. If you don't get them early, you can't, right? If you want to see how to clean a trailer, AHES has a nice little YouTube video that I stole. Not the video, just a snip of it. So transport them, sure, but just take it easy, be sensible, basically use your common sense. Can you exercise a horse? Yes, you can exercise a pregnant horse. Horses are designed to escape from wolves and saber-toothed tigers, right? So they have to run. Otherwise, there's no more horses, at least no more pregnant horses. And if there's no more pregnant horses, there's no more horses. So yes, exercise. Some people like to recommend there's no or only really light work in the first 30 days. There is some evidence that if you work her hard early in pregnancy, and I'm talking the first week or so, you can increase the rate of embryonic loss. So try and avoid that. But there are a lot of mares on the show circuit, including the performance circuit, that do get flushed for embryos, right? So it just depends on your discipline. You wouldn't send a horse out on an 100-mile endurance ride, right? If you were trying to get her pregnant and you just bred her the day before. That's probably not going to help your chances. In most jurisdictions, or a lot of them, thoroughbreds can legally race up to 4 months pregnancy. We'll see that there's not much of a fetus by 4 months. The fetus hasn't really started to grow at all. Most recommendations are you avoid anything super strenuous after 5 to certainly 6 months. So, no big jumps, nothing like that. Probably you want to cut back on the reining and the barrel racing by that point. So it's just a general thing. But if you're just going to go for a walking trail ride and she's a calm mare, there's nothing to stop you doing that up till a month or two before she falls, right? All you might need to do is accept the fact that her barrel is now a heck of a lot bigger and you're going to need a different saddle to put on her. And you should not keep a mare confined when she's pregnant. Stabled mares, if they're pregnant, especially late pregnant, they need turnout. Otherwise, they're going to stock up. And so they should be out at least 6 hours a day, and preferably they're out pretty much most of the time to do it. So yes to exercise. This is just some of that data. This was a study out of Texas looking at exercise versus no exercise. And these horses got exercised for 30 minutes at a trot and a canter, basically. So moderate sort of exercise. They built a sweat. And they flushed them at 7 days. And so if they didn't get exercised, the horses there, you got 63% embryo recovery rate. So you got an embryo 63% of the time. In the horses they did exercise, nearly halved, right? So 34%. And this same group has done another study up at Clemson, and they got a similar kind of result. So early on, maybe don't do anything too strenuous with them. They've also looked at it at 16 to 80 days, and this was small numbers, right? So there's only 4 horses in each of these groups, but they did a bit more intense exercise, got them up to a canter and gallop between days 30 and 80 for, I think it was like 3 10-minute bursts, 3 5-minute bursts separated with a walk down, and they didn't lose any foals, right? And there was no difference in gestation length. There was no difference in how well they fold out, no difference in foal size. It is known that elite human athletes, especially elite endurance athletes, if they continue to do at their elite level for a long way through pregnancy, they do have smaller kids, but nothing actually wrong with the kids, survival-wise. We're going to have to whip through nutrition because I see it's 6:47 and Mindy's going to yell at me soon. So the bottom line is body condition scoring is your friend, and we would like brood mares to be in a body condition score of 5 to 6, and I personally prefer about 6, a little bit of extra weight on them. And if you want to figure out how to body condition score and get good at it, get one of the tables, and there's a nice video on the extension website for the University of Minnesota. So go look that one up. I mean, it walks you through it. But the reason I want them in a 5 or 6 body condition score is they're more efficient to breed there, right? And after she falls out, I'm going to want to breed her again. So pregnancy rates start to get better once they're at a body condition score when I start to breed them of about 5 to 6. And it's less cycles to get them pregnant, which means it's cheaper for you because you're not paying as many vet fees and semen shipping fees, right? So nice body condition score. Best time to body condition score her if you have to change her weight is sort of late summer, fall, because late summer and fall, there's still forage around. There's not much temperature stress on her, so it's a good time to put weight on. It's an easy time to put weight on her, and you can do it with a kilo or so, a couple of pounds to 3 or 4 pounds of concentrate. Take about 60 days to build her up. One body condition score, which is about 20 kilos on an average size mare. If she's overweight, the best time for her to lose condition is fall, late fall and winter, because it gets colder. She needs more calories to keep warm. So you can use that to help milk some of the weight off her. But I want you to have the weight off before I want to breed her again, because losing weight while you're trying to breed them, even if they're still a little bit overweight, isn't a good thing. I want them stable or even gaining a bit of weight while they're being bred. They're more fertile if you do that. So who are we feeding when she's pregnant? We're feeding the mare, and especially in late pregnancy and early lactation, her own maintenance requirement will go up because she's eating more, so she has to digest more, and she's got to move around more to forage. You're doing the foal, so you've got to develop it, and there's more stuff for the placenta and the uterine size and eventually udder development. And then she's actually going to want to put on some reserves for lactation. She naturally wants to do that. So most mares are going to gain about 12 to 15% body weight through pregnancy. The data says younger mares will gain a bit more because they're still growing, and weight gains of up to about 16%. Obviously, you can make them gain more, but that's about what you should expect for her to grow. And the foal, when it's born, is going to weigh somewhere between about 7.5% and 11% of the mare's body weight before she was pregnant. So this is kind of an example of body weight change in a mare during pregnancy. And they actually start to ramp up the rapid body weight change in mid-gestation. And that's before the foal really starts to grow fast, right? So they have this drive to kind of put on some weight there in mid-gestation. And essentially what happens to these mares in early and mid-gestation is they go into a state of an anabolic state. So basically they get more efficient at absorbing glucose, and they drive that absorbed glucose, because the foal isn't growing much yet, they drive it into their body tissues, into their muscle and their fat. So they start to put on a bit of weight. And they're building their body stores for their later pregnancy and their lactation, when, if you think about it, mares give birth in the spring. So naturally they would have gone through late pregnancy and early lactation, or at least late pregnancy, when there wasn't a lot of feed around naturally. So they want those body stores to use. When she gets to late gestation, late pregnancy, her glucose absorption goes up even further, but she then becomes insulin resistant. So she doesn't push that glucose into fat and into muscle. What she does is she leaves it circulate, and then the placenta can take it and drive it into the foal. So the foal gets to grow fast late in gestation. And this is basically just that in a graph, and we won't go over that one. This is the foal growth rate. So the foal really doesn't grow much till about 200, 240 days, right? So for the first 6, 7 months, 8 months, it's not doing a whole lot. It's still pretty small. It gets to be about the size of a beagle, maybe at about 6 months. And then it really rips off late in gestation. So that's when she really needs calories for the foal, but she gave herself some reserve earlier on before the foal needed it. So if you look up the NRC recommendations, this is what they look like for how to get a foal, how to get a pregnant mare through pregnancy nutrition-wise. And it looks horrible and it's a disaster, right? So we'll do it practically. So essentially, for the first 4 months, you think of her as not being pregnant. She doesn't need anything extra. So she's just on her regular maintenance. and you maintain her body condition score to keep her at a 5 to 6, right? And accepting that she's going to want to start to put on a bit of weight towards the end of that time. She should be able to meet that based on forage pretty much alone, and any mare should have a minimum of 50% of her daily dry matter intake coming from forage. So grass or hay, right, is what you want. You don't want too much concentrate in there at all. If the pasture is really good, she doesn't need anything at this point other than pasture and some mineral and vitamin balance, and especially mineral at that point. Her voluntary intake is going to increase as she goes through. So she's going to start her voluntary intakes probably 1.5 to 2%. By the time she's in late pregnancy and lactation, her voluntary intake will be about 2.5 to 3% of her body weight per day in dry matter. So it really ramps up towards the end. So how do you do it? Basically, you figure out what she needs for energy and protein first. Forage is going to handle most of it. And maybe as she gets further through the gestation, you're going to have to add in a little bit of concentrate. But that also varies with your forage, right? If she got pregnant real late in the year and you go into fall, the forage is not as good. Forage is best when it's leafy, not when it's stemmy. It gets less energy and protein. So forage isn't so good, you're going to have to give her an energy protein supplement. But once you've got your energy and protein right, then you just balance the minerals and vitamins. Forage is okay for some minerals, not for others. Fresh forage is really good for vitamin A and E. Hay is not so good. Hay is better for vitamin D than fresh forage is. But usually you'll find that any balancer you give her will be something that corrects those issues. So this one here, mostly around here, we've got cool season grasses, and they have really good energy values if they're growing rapidly, really good protein values. So they're good for horses with high demands, like pregnant and lactating mares. They're not so good for horses with metabolic syndrome. Cool season legumes are also real good. They got good protein, good energy values. So that's things like alfalfa and clovers is what we're talking. Cool season grasses are stuff like timothy and fescue, things like that. Protein level, minimum of 8%, and that's absolute minimum early on, and she's going to go to 12% late, and that's for the whole of what she's eating. The quality of the protein is super important. She needs really good amino acids, and lysine is the first of those that becomes limiting. So the sort of protein sources you're looking for, some fresh grass will be okay, but when you get to hay, grass usually doesn't cut it, so some alfalfa needs to go in there. Processed soybeans, if you look at the label on a feed, a lot of their protein comes from soybeans, and some of it comes from milk products. So if you look at the forage here for cool season, protein levels pretty good for fresh forage, less good for the hays. For legumes, it's all good whether it is fresh forage or a hay. So you can use those to help balance stuff out. And this essentially says the same thing, so I'm just going to skip over it. The mineral stuff, calcium and phosphorus are good in fresh forages, but you might supplement her when she hits lactation. Potassium is also good for minerals. Sodium and chloride, which is basically salt, are often low, so we'll need a supplement. And then the trace minerals are also often low, so they need a supplement as well. And how you supplement them depends on where you are. So you know that selenium really varies depending on where the forage was grown, and you might have brought it in from a deficient area. So sort of talk to your extension agent or talk to the person who provided the forage to know what your selenium supplementation should be. Vitamins, already said that fresh green grass is great for A and E. To get vitamin D out of forage, it needs to be sun cured. So older forage is a bit better, but hay is real good. And vitamin B, they make all their own vitamin B in the gut, so they don't need a supplement for that. And again, fresh forage, really good for them. Hay's not so good for that one. So you need to supplement those. So how do you do it? Probably should have started with this. Early to mid-pregnancy, if she's got good quality forage, all you need is a ration balancer to give her the minerals, right? And maybe a little bit of vitamin D if it's too lush and she's not getting any vitamin D. Mineral blocks aren't real good because some horses eat too much of them and some horses never touch them. So you really want to just feed her an appropriate balancer, and it depends whether your pasture or your hay is predominantly grass or predominantly legume, which one you use. And that will balance it out. And it's usually like half a pound to a pound a day. So you've got to feed them individually. If you've got, when she gets to mid and late pregnancy, or your forage is poorer, then you're going to have to start to whack a concentrate into the mix. If the forage stays really, really good, you may be able to get through her just with a balancer, but that forage being really good, it's going to deteriorate in winter, right? It's not as good in the winter. Once you get your concentrate level up, so you're feeding, so say 5 pounds a day of concentrate, then that concentrate is also fortified with vitamins and minerals, and you can actually drop your balancer out. So if you're feeding only a pound of concentrate a day, you still need the balancer. Once you get up to bigger levels of concentrate, so long as it's balanced and fortified, you can get away with you getting rid of your balancer to start with. So this is just an example. Early on, this mare is getting grass forage, and she's getting about 20 pounds a day of that grass forage, and she's just getting a balancer that goes with it. By the time she's in late pregnancy, she's had to move to a better quality forage, so she's getting about 22 pounds a day of a really good forage mix, and she's added in a couple of, say, 3 to 4 pounds a day of a fortified concentrate that's giving her protein and energy for her needs. And then as she gets later in pregnancy, she's going to need more of that to maintain her body condition while that foal starts to move. You can see down the bottom here, you just keep watching her body condition and adjusting as needed. So the general rules for feeding the concentrates are, if you need a really large amount, so you're giving, 3 kilos or something, so say you're giving 5 pounds, you split it up through the day. And I've seen mares that are getting 12 pounds of concentrate plus a day, easy. But you split it up 2 or 3 times a day. Replace things slowly. So make your transitions slowly, and try and keep the starch down. So sometimes we'll actually have to transition to a diet that has less starch and a bit more fat in it, to keep the starch levels down, especially if the mare that you have pregnant is one that's prone to metabolic syndrome. And they do have those feeds available. So it's basically based on that demand for nutrition. Sometimes there's complications, right? So if she got pregnant early in the spring, that means she's getting to late pregnancy in the winter. So we don't have to actually only feed her for pregnancy. We have to feed her for the demands of cold if she's kept outside. And that might up your energy requirement by 20 to 50%. So she's going to need extra forage, extra concentrate in order to get that extra energy that she needs to maintain her body condition. The other deal is, a lot of mares, they're going to fall and you're going to get them pregnant again. So the early part of pregnancy is going to actually be covered by lactation. So that early part of pregnancy, she doesn't need a lot of groceries for the pregnancy, but you are feeding her for the lactation that's going on, not for the pregnancy, right? And she may actually start to lose a little weight there, which is a problem if you're still trying to get her pregnant. So you want to try and keep as much weight on her as you can. And then once you wean her, so she'll then be about 4 or 6 months pregnant if she got weaned at 5 months or so, and pregnant at 30 days, then you may back her down a little for the weaning, and then you just monitor her body condition score and see where she's at, and make your amount or volume changes slowly. So you have to sort of take into account what she's doing. And lactating mares, the dotted line here is a lactating mare and the straight line is a non-lactating mare. So you can see lactating mares start to actually lose weight as they're going from about 30 days of lactation. They'll often lose weight if you don't feed them to maintain it. So you've got to be kind of careful with the lactating mares. Lactation is the biggest demand on the mare's body. She's basically going up. And this is the nutrient requirement for mares in lactation, but I think it's better to look at it compared to pregnancy, right? So her digestible energy requirement from late pregnancy to early lactation goes up by half, right? Same with her protein, same with most of these things. She needs half again more than what you were giving her before in order to maintain that lactation and keep her body condition good. So feeding for lactation is going to need an increase. So these are just examples for how much she might need. Late gestation, she's on a good quality legume grass mix. She's getting about 20 pounds a day of it, and she's getting about 5 or 6 pounds a day of a concentrate. Early lactation, she has to bump that up by another, 3 pounds or something of forage and a couple more pounds of your concentrate, at least, to get her through that lactation. So other thing to remember is once you've got that foal getting close to weaning, that foal is going to be stealing some of her concentrate. So you're probably going to have to add a kilo or so of concentrate, a couple of pounds of concentrate just for the foal. And then the last one is water. And essentially, requirement for water during pregnancy is the same as maintenance, right? So mare's going to drink about 30 litres of water a day. It's going to vary by horse, and depending on if they're in dry food or pasture, obviously. The requirement during lactation doubles, right? So she is now going to drink one heck of a lot more water a day, because most milk is just water, right? The vast majority of milk is water. So in here, when we have a mare that falls out here, she instantly gets 2 water buckets, because she will drain 2 water buckets in a couple of hours. So we try and keep them up to her. All right. I have come to the stopping point. So I'm going to stop my share, and I am going to take questions. And I am sorry, it's already 7:05 and I'm a total bum for keeping you from your dinner. What questions can I answer? Does someone want to ask? I see a couple already that I can actually read off. Or Mindy, are you going to yell them at me?
Yes, I'm going to yell them at you, Scott. We'll just probably be able to answer just a couple here just because of the time. But it was a great presentation, and what we can do is these questions that don't get answered. Scott, I think what we'll do is I will send them in an email to those that have registered or signed up for tonight. And then when we send them the YouTube link, we'll also include the answers to the other questions that we had that we can't get to. So the first one, well, you actually covered the mare's vaccination and worming. There is a question specific to Frisian mares, how much protein versus fat for Frisian mares. This person has a mare that's hard to keep. It's hard to keep a top line on during the pregnancy.
So I guess my first question would be, how old is the Frisian mare? That's going to change the answer a little bit. So lack of a top line can be a bunch of things. It could be the nutrition. So it will depend how you feed her, depend on what she is prone to. So if she's a mare that's a little prone to metabolic syndrome and she's got plenty of fat everywhere else, but she just can't maintain the top line, you're going to have to watch the amount of starch you're giving her. But you can get feeds that are pretty good on protein and fat, so like a 14% protein and maybe a 7% fat feed with limited starch. So not to name names, but some of the feeds designed for mares and foals, some of the strategies or the safe choices, if you use one of those, they will have the reasonable level of fat and protein. But if she's not maintaining a top line and she's older, and by older I mean a teenager, you may want to think about getting her tested for equine Cushing's syndrome, because loss of top line is a classic for that. Or she may actually have some kind of back issue or lameness issue, which is meaning she's not using the muscles as well as she should be. That'd be another thing to check out. But yeah, look at one of those, depending on if she's got some issues with metabolic syndrome, which some of those older Frisian mares do. You may want to think of one of those 7% fat, 14% protein type feeds. Some of the mare and foal feeds go up to 16% protein. So you can use
Okay.
one of those as well.
Well, thank you, Scott. I think what we'll do is we'll close just because we ran over at 7:08. And like I mentioned, we will answer the other questions that we have received in an email. So I'd like to say a special thank you, Dr. Madill, for your time, presentation, and insights this evening. And thank you to our many participants that shared thoughtful questions in advance and during the presentation. As always, the Piper Equine Hospital is here for you 24/7. Our West Metro Ambulatory Clinic is in Long Lake and also available for the care of your horse, so please don't hesitate to reach out. If you enjoyed the learning and information provided tonight, we encourage you to visit our website at www.equineumn.edu or feel free to reach out to us directly. And lastly, we hope you will consider supporting our equine program. We rely heavily on philanthropic support to provide the excellent care in our clinical services, education of the next generation of our equine practitioners, and the advancement of equine research. Thank you so much again for attending this evening and hanging in there with us as we went over just a little bit. Have a great night.